Today we will learn about frontal lobe traumatic brain injuries. You will be able to define frontal lobe traumatic brain injuries and what it affects, and apply occupational therapy treatments to frontal lobe TBIs. A TBI, or traumatic brain injury, is a non-degenerative acquired brain injury from a displacement of the brain inside the skull. The DSM-5 categorizes the severity of a TBI as mild, moderate, and severe. This is based on the duration of loss of consciousness, post-traumatic amnesia, and the severity of confusion at initial assessment during the acute phase of the injury. A severe TBI can also be farther subcategorized as a coma, vegetative state, persistent vegetative state, and minimally responsive state. There are 1.7 million TBIs that occur every year in the United States. That's roughly 1/3, or 30.5% of injury-related deaths. Ages 15 to 19 years old and elderly 65 years or older is the most common age group, and it is more common in males than females. Between 3.2 and 5.3 million persons live with long-term disabilities that result from a TBI. There are many causes of a TBI, but some of the most common ones include falls, motor vehicle accidents, violent assaults, or sports-related injuries. There are also a large amount of symptoms that can be seen within a traumatic brain injury, including changes in level of consciousness, memory disturbances, nausea and vomiting, agitation, impulsivity, seizures, and many more.
Now we're going to talk about the frontal lobe. It is located from our foreheads to mid-temple. It allows all brain functions to work together and is made up of the left and right lobe. The left lobe is language-related movement, and the right lobe is nonverbal movement. It allows for higher levels of thinking, such as planning, multitasking, risk assessment, and social interaction, and is not fully mature until age 21 to 22. It is often injured due to its location. It can be pushed forward into the skull, which causes bruising and tearing, and it can be twisted, for example, in a high-speed accident. One example of frontal TBI is Phineas Gage. He was a railroad worker who had a metal rod pushed through his skull. This caused personality change and led to the idea that the self comes from the frontal lobes. Cognitive and motor function come from the frontal lobe, and they can be impaired in TBI. Cognitive function includes divergent thinking, flexibility, problem-solving, attention, memory, and more. Motor function includes fine movements, strength in upper extremity, complex motor movement, spontaneous facial expression, and speaking. So what happens if you have a frontal lobe injury? You get disinhibition, difficulty multitasking, difficulty initiating actions, and social problems occur with this injury. Cognitive aspects can diminish and lead to dementia and Alzheimer's at an earlier age. And neuroplasticity or rewiring can occur with cognitive retraining. Pop quiz. What are the two types of frontal lobe impairment? Cognitive and motor.
Three common functions of the frontal lobe that are commonly impaired in a frontal lobe injury that have to do with cognitive function are initiation, planning, and organization. Initiation is your ability to begin a task. That would require a person to recognize that a task needs to be completed, then figure out a way to begin the task, and then actually complete the task. Planning is the ability to come up with all the steps that are needed to complete a task, as well as know the duration of the task and any materials that will be used. Lastly, organization is the ability to put all the tasks or steps that are required in initiation and planning in the correct order and have the flexibility to change the order of the tasks if needed. Organization also includes the ability to put items or information in the correct place so that they can be retrieved at a later time. Now it's time for a do-it activity. List a task associated with getting ready in the morning and think about how initiation, planning, and organization are utilized in this task. For example, one thing you'll need to do in the morning is brush your teeth. In order to do that, you'll need to realize the need to brush your teeth, which is initiation. Then you'll need to have toothpaste and toothbrush and water and know all the steps that are required to brush your teeth. That would be planning. Lastly, you'll need to keep your toothpaste and toothbrush stored in a logical place and be able to put the steps in the correct order. For example, put your toothpaste on before beginning to brush your teeth. That would be organization.
Initially, the occupational therapist will perform an evaluation to assess the client's situation. This allows the therapist to develop an occupational profile and observe their occupational performance. The therapist takes this information and then develops an intervention plan for the patient. The particular recovery phase the client is in determines what types of interventions and assessments the therapist will utilize. During the acute rehabilitation recovery phase, the therapist addresses the needs of patients with agitation, cognitive impairment, and areas of occupational performance. During the outpatient recovery phase, the therapist uses interventions to improve upon social and coping skills, occupational performance, education and work activities in context, and community mobility. During the outpatient recovery phase, the therapist will send the patient home with items to work on during their daily lives. This, to help with initiation, planning, and organizing, the patient should attempt to minimize distractions, and examples of doing this would be to focus on one thing at a time and putting things away after use. They should try to follow a routine, such as setting specific days for specific chores, and using organizers such as lists, calendars, and address books. We hope you've enjoyed our presentation, and if you have any questions, please ask us.